Okay, so the next thing we're going to talk about is the processes that occur in nutrition. So we think, oh, food goes in, gets where it needs to go, I'm all good, right? There are a lot of pieces involved in that. So when we have a patient with a nutrition problem, we need to see where that process broke down. So first of all is ingestion. That's actually getting the food into the human. Ingestion is eating. What factors might assess ingestion? What factors might assess what food actually goes into a person? That's going to be the food that's available. Okay. Food availability, how much food is available, what's the quality of food available to that person. Preferences. Some people have strong food preferences. Some people have strong food cravings. Some people have strong aversions. Some people just can eat whatever is available. So preferences, allergies and intolerances. You need to know the difference. An allergy is an IgE mediated immune reaction. When the person is exposed to the allergen, they have an inflammatory response. That response can involve rash, stomach upset, nausea, vomiting, diarrhea, upper airway congestion, drainage, sneezing, things like that. It can also progress, those allergies can progress all the way to full anaphylaxis. So allergies and IgE allergies tend to become progressively worse with greater exposure. There have been some research studies into micro exposures to food allergies to gradually increase tolerance with some success, but typical exposure, each exposure tends to make that allergy response worse. An intolerance typically isn't life-threatening, but the person is unable to tolerate a particular food. So an example would be lactose intolerance. Person is lactose intolerant, they lack lactase. They do not produce lactase. Lactase breaks down milk sugar or lactose. So if they consume a dairy product with lactose in it, they don't have the lactase to break it down. And so that lactose sits in the gut and ferments. And when it ferments, it produces gases. Those gases cause intestinal gas, pain, sometimes nausea, but also they stretch the lumen of the bowel, which causes increased peristalsis. So they also cause diarrhea. So that's lactose intolerance. Lactose intolerance is not going to cause someone to die unless they are consuming so much lactose containing food that they're not able to retain adequate nutrition. Then it'd probably make them really sick first. So, but allergies can actually be life-threatening. Chronic or acute illnesses. If someone is acutely ill, you've got the flu, you've got a stomach bug, you've got a cold, you may not feel like taking in as much nutrition. Patients with chronic illnesses may also have decreased appetite, but they may have that decreased appetite or decreased ability to take in nutrition all the time. Medications. There are medications that increase appetite. There are medications that cause food cravings. There are medications that suppress appetite. So those things can affect intake. There also are medications that cause nausea. So it makes it more difficult for people to eat. There are cultural and religious factors in the foods that we choose to eat, how much we choose to eat, how, at what times, and prepared in what ways. And so cultural and religious factors affect food intake, and there are time constraints. How many of you eat more meals than you know is healthy from a hot box or a fast food place? Time constraints have a major impact on what food we're taking in. To assess ingestion, the primary thing we want to do is a food diary. We want a person to write down everything they take in for a set period of time, usually 2 to 3 days. There are some other ways we can have them sit down with a list of foods and check mark how many times have you eaten these in the last week, things like that. The gold standard is food diary. It's not always easy. So we've got the food in, now what happens to it? Now it's digestion. Digestion begins in the stomach. primarily occurs in the stomach. Some further breakdown of nutrients occurs in the small intestine, but for the most part, that's going to be in the stomach. It actually begins in the mouth, but most of it takes place in the stomach. We actually produce amylase in the mouth that starts to break down sugar so that we can absorb them. What factors affect how well food is digested or broken down? Well, part of that is going to be, do I have some sort of illness that makes my stomach not work right now? If someone has gastroenteritis, their stomach may actually not be working right now to break down those foods into nutrients. And if that's happening, then the food is just sitting there. That's so a gastrointestinal illness can decrease digestion. There are enzyme deficiencies like lactase deficiency that means we don't break down lactose well. There are some other enzyme deficiencies that are, that's just one of the most common. An immature gastrointestinal system is going to break down foods less well. Newborn GI tracts are able to break down breast milk into its component nutrients very efficiently, but they aren't able to break down a lot of other foods. We actually have to alter other foods in order to make them digestible by newborns. That's why we feed newborns formula and not cow's milk. Another thing that affects digestion is time in transit. If we have really rapid peristalsis through the GI tract, the food may not be in the stomach long enough to break down. So time in transit's a factor. So how are we going to assess digestion? We're going to be assessing for history and family history because there may be some hereditary things going on, but we're also going to be assessing GI symptoms. What symptoms does that patient have? Are they having nausea, vomiting? Are they having large amounts of undigested food pass through the GI tract? What symptoms are they having? The third thing is absorption. So we get the food in, it has to be broken down, that's digested, and then the nutrients have to be absorbed. The majority of absorption occurs in the small intestine. That's why the small intestine is really, really, really long, and it loops and loops and loops and keeps coming back and looping more and more, because we absorb most of nutrients in the small intestine. The small intestine, the inner lining, has a lot of little projections into it called villi. And each villus has a lot more little projections off of it called microvilli. So that means that we have this really long intestine, and then the internal surface area of that is much, much larger because we have the villi and the microvilli that increase the surface area. So that allows for the food that's passing through the small intestine, or now the broken down food, which is now it's called chyme, and it's broken down food and acids from the stomach, but the nutrients get absorbed out of that by the small intestine. So what kind of things are going to affect absorption? Again, if we're moving things through that GI tract too quickly, the small intestine doesn't have time to absorb enough of it. So chronic diarrhea can decrease absorption of nutrients. If the gastrointestinal tract is immature, it's not ready to absorb a lot of those nutrients yet. Again, for newborn humans, the first 6 months that their GI tract is really set up to absorb nutrients best from breast milk. There are alternatives. The only acceptable alternatives are going to be commercial infant formulas that have been formulated to be digestible and absorbable by an immature GI tract. GI illnesses, anything that's going to cause your gut to speed up, or we can have damage to that lining of the small intestine. Celiac disease is an immune disorder in which the person has an immune response to gluten. And over time, that causes damage to the inner, to the lining of the small intestine. And so we have fewer villi and they're smoothed over. So that decreases the surface area for absorption. So someone with celiac disease, if it's not managed properly, they can have a lot of absorption problems. Assessment, whereas when we're assessing patients for absorption issues, we want to assess, are you having gastrointestinal symptoms? But we also want to look for symptoms of those deficiency syndromes. The final piece of nutrition is metabolism. And that's when the nutrients get to where they need to go and perform the duty they're there to perform. So what are the kind of things that affect metabolism, body composition? The more muscle mass we have, actually, the more energy we use. So if we have less muscle mass, then we're more likely to have an excess of energy that we store as fat. Intake of adequate nutrients. A lot of the nutrients themselves are important to metabolism. So what are some things that might speed up metabolism, and that speed up how quickly we're using macronutrients, but also maybe how quickly we're using some of those micronutrients? Muscle mass and body composition, we talked about. Caloric intake, what we're taking in. The temperature, if the temperature in the room is a comfortable neutral thermal environment, then we don't expend a lot of energy trying to maintain temperature. But if it's a cold room, we expend energy trying to warm up. And if it's a warm room, we expend energy trying to cool off. Stress increases metabolic need, but also stress changes. It triggers some hormonal changes that slow down our metabolic processes. So stress can actually cause weight gain while it increases caloric need or energy need. Growth, when we're growing, we need more energy for that growth. So when someone is growing, they may actually be taking in a lot more protein than typical, because they're trying to get their body's asking for, hey, we need more protein. So they're trying to get enough protein in to fuel that growth. Pregnancy and lactation, because of growing a separate, an individual, growing a fetus that will eventually be a separate individual, and lactation is actually supporting a separate individual. Aging. Children tend to have more rapid metabolism that slows down in adulthood. There are some times that it increases again with that adolescent growth spurt. It's going to increase again, then slows back down in adulthood. With pregnancy, it increases. And then as we age, our metabolic rate slows down. Gender, men tend to have a faster metabolic rate than women, and that has to do with muscle mass. Metabolic disorders. There are some disorders, most of them are genetic, in which people are missing key enzymes to break down certain nutrients. And one example of that is PKU, phenylketonuria. In PKU, the person lacks the enzyme to break down phenylalanine. So phenylalanine builds up in body tissues. In particular, it can cause neurologic damage. So in order to protect that patient from neurologic damage, they are recommended to be on a very low phenylalanine diet. So there are some other examples, but that's how metabolic disorder typically works. Body temperature, if I'm running fever, I burn more calories. If I'm cold, my metabolism may actually slow down to try to conserve energy. Movement, voluntary movement, getting some exercise, I burn calories and I increase my metabolic rate, but that also applies to involuntary movements like tremors. Thyroid hormone. The thyroid hormone is critical in metabolic processes. And if we're not producing thyroid hormone appropriately, if we've got too much, then our body's just in overdrive all the time. We burn off all the calories. We have a higher temperature, a higher blood pressure, a higher heart rate. If we don't have enough, then we're not burning any calories. They're just sitting there, even if we take them in, and we're exhausted and weak and tired. So thyroid hormones are critical in the metabolic processes. Trauma or tissue injury is always going to increase metabolic need. You've got to heal that wound. Illness increases metabolic need. And there are medications that increase metabolic rate and medications that decrease metabolic rate. So when we're assessing metabolism, we want to look at body composition, but we also want to look at intake, and we want to start looking at things like hormone levels, and does this person's reported intake match their energy levels and energy expenditure. Okay, so the next section, we're going to talk a little bit more about nitrogen balance.